So, pathophysiology. Generally, we have a problem in case of the intervertebral discs. And the problem that persists generally in the cartilages around the joints. Yes. The problem is that the cartilage does not have its own vascularity. Yes, it does not have its own vessels. Because of it, there is a very big problem with getting enough nutrients and oxygen to the area. So there is a very big problem to sustain living of this tissue. And if the tissue would not have enough of the nutrients and would not have enough of the oxygen, it would die. And when the cartilage dies, it loses after some time its mechanical properties. So it becomes weak. And when it becomes weak, it may deform, and these deformities may lead to pain. There is also something called metalloproteinases. So metalloproteinases are the enzymes that are breaking down the cartilage. These enzymes are good, generally speaking. These enzymes are breaking down the cartilage, so the cells are renewing this constantly. Yes? So it's breaking down the old cartilage and the chondrocytes, so the cells of the cartilage are creating some new ones. However, if the vascularity is not big enough, the chondrocytes would not have the strength to create new ones. So the metalloproteinases may accumulate and destroy the cartilage more than it's renewed. And this will lead, of course, to the mechanical instability and pain. So, what are the main etiologies of the lower back pain? The majority of the lower back pain originates from the various spinal components such as the spinal nerve roots, facet joints, contiguous paraspinal muscle and ligaments, also sacroiliac joints. So why not the intervertebral discs if we were talking about so much about them? Because intervertebral disc as a cartilage is innervated. Yes, there are no nerves there. There are no nerves in the cartilage. That's why it's not painful. Although it may be extremely pathological. Yes, it can be extremely changed. It would not be painful because there are no nerves there. But all of the structures around that may be pushed or pulled or locked by the deformed cartilage, by the changed anatomy, will be painful. So, okay. Generally, low back pain of the spinal ridge typically is not life-threatening and is due to self-limiting degenerative conditions that seldom cause neurologic compromise. Luckily. Yes. It's so generally, this is very common, but very frequently it's not something that will lead to disability. Yes, still it's painful. Yes, and still in many cases it will lead to severe problems. So, just getting back to the possible etiologies, we can have the musculoligamentus strain or sprain, herniated disc. So herniated disc, one more time, is when we have the articular disc and some part bulges out. Yes, because we need to remember that we have the nucleus pulposus in the center, so this is like a jelly that is good in absorbing the force, but this only as good in absorbing the force as strong is the surrounding ligamentous tissue. Yes, so this ligamentous-like tissue around is annulus fibrosus. Yes, and this annulus fibrosus is holding the nucleus pulposus inside. If the annulus fibrosus gets weaker, or the force exerted on the intervertebral disc is too big, it can bulge out, and it is called the herniation. We can have also the foraminal stenosis. What is it? Looking from the side, we remember that between the vertebrae there are places for the nerves, from the roots of the nerves to get out. Yes, if because of some pathology like the osteophytes, like anything else, those places would be pressed by the bone, we would have the pressure on the nerves, and of course it will be painful. Spinal canal stenosis, causing neurogenic claudication or myelopathic symptoms. So if this pressing, because for example some fracture, osteoporotic fracture of the vertebrae, or because of the bulging of the discs of the herniation into the spinal cord, it may press on the spinal cord and leads to a lot of different problems, including pain. Facet joint dysfunction and arthropathy. Yes, so the facet joints are the joints as all. Yes, so they can have problems with the osteoarthritis, and the osteoarthritis generally is painful. Sacroiliac joint dysfunction and arthropathy. Sacroiliac joints are quite specific. Yes, they are highly stable, but they have they are providing very little mobility in normal cases, and this leads to the situation that, theoretically speaking, they should not be so problematic, but they are. Why they are? It is not very clear, but a lot of inflammatory conditions of the rheumatologic diseases are affecting the sacroiliac joints. And we have the myofascial pain syndrome, so pain related to muscles and fascias. Okay, let's